Can you have Crohn's disease without symptoms? Have you ever wondered if someone can have Crohn's disease and not even know it? The answer is yes, it is indeed possible. This condition is often called asymptomatic or silent Crohn's disease. In these cases, inflammation is present in the digestive tract but does not lead to noticeable symptoms like diarrhea, abdominal pain, or rectal bleeding. Many people with silent Crohn's disease find out about their condition during routine procedures like colonoscopies or imaging tests done for other reasons. Crohn's disease is a type of inflammatory bowel disease characterized by chronic inflammation that can affect any part of the gastrointestinal tract. Typically, doctors diagnose Crohn's disease when symptoms prompt a medical evaluation. However, some individuals may have active inflammation without showing any symptoms. This makes it harder to detect the disease early on. For those who have a sensitive stomach, irritable bowel syndrome, or colitis, it is important to understand that while symptoms can overlap, they are not the same. Irritable bowel syndrome is a functional disorder without inflammation, while Crohn's disease involves actual inflammation and potential tissue damage. Colitis refers to inflammation of the colon, which can be part of Crohn's disease or other conditions. Asymptomatic Crohn's disease has some key points to consider. First, it is often detected during screening colonoscopies or imaging tests for unrelated health issues. Patients may feel perfectly fine but still have underlying inflammation. Monitoring is essential even when there are no symptoms. Inflammation can progress and lead to complications over time. Regular monitoring through blood tests, imaging, and endoscopic evaluations helps assess disease activity. When it comes to treatment decisions, doctors may choose to closely observe asymptomatic patients rather than start immediate therapy. This is because treatment can come with risks and side effects. However, if inflammation worsens or symptoms develop, treatment may become necessary to prevent disease progression. It is important to note that some patients with silent Crohn's disease can develop complications that requiring hospitalization if inflammation is left untreated. Therefore, objective measures of inflammation are critical to guide management. For those with sensitive stomachs or symptoms similar to irritable bowel syndrome, it is vital to communicate any changes to a healthcare provider. If diagnosed with Crohn's disease, even without symptoms, staying engaged with regular checkups is important to detect any changes early. In summary, Crohn's disease can exist without symptoms, but this silent inflammation still requires careful monitoring to avoid long-term damage. Understanding the difference between symptom-driven conditions like irritable bowel syndrome and inflammatory diseases like Crohn's is essential for appropriate care and management.